Biosafety cabinets are primary containment devices designed to protect laboratory workers and the surrounding environment from potential exposure to infectious agents. In the event of an emergency or cabinet malfunction, operators must be prepared to quickly react in a safe and secure manner. Spills can happen to the most seasoned laboratory personnel. Standard operating procedures for BSC use should therefore include procedures for spill cleanups inside a BSC. With any spill inside the biosafety cabinet, a risk assessment should be performed to determine the severity of the event. Factors to consider include the volume of material spilled, the potential titer of the agent involved, if the spill is confined to a small area or is spread over multiple surfaces, and whether your PPE may have been contaminated in the process. In the event of a high-risk spill inside the biosafety cabinet, which can involve large volumes, multiple contaminated surfaces, high titers of infectious agent or gross contamination of PPE, the following general procedures are recommended. A small amount of cleanup-related supplies should be kept inside the cabinet during routine work. Contain the spill if possible by covering it with absorbent towel. Remove and discard contaminated gloves within the BSC. If 2 pairs are worn, discard the outermost layer. If sleeves are potentially contaminated, remove the lab coat or gown and place into a bag for autoclaving. Wash your hands, and if necessary, don a clean lab coat or gown. Put on a fresh pair of gloves. Allow any aerosols generated by the spill to be removed by the cabinet's HEPA filter. This requires that the BSC blower be left on and the sash remains at the appropriate level to filter aerosols generated by the spill, typically 5 minutes for most BSCs. During this time, refrain from doing any work in the cabinet. Take this opportunity to prepare for the cleanup. Gather any additional materials required to deal with the spill and for the safe removal of contaminated materials from the cabinet. Choosing the most appropriate disinfectant for the known or suspected agent you're working with should be part of your risk assessment. As a general recommendation, sodium hypochlorite, commonly known as bleach, is an effective broad-spectrum disinfectant when used at a concentration of 5,000 ppm. Higher concentrations may be required if deemed necessary, as per the risk assessment. After the aerosols have cleared, cover the spill with disposable cloth or paper towels if not already performed. Starting at the outer margin of the spill area and working in a circular motion towards the center, pour disinfectant over the absorbent paper and the immediately surrounding area. Leave the soaked paper on top of the spill for the appropriate contact time. In the meantime, surface decontaminate any reusable supplies using an absorbent paper soaked with disinfectant. If material has spilled through the grill of the BSC, pour disinfectant through the grill to flood the catch tray underneath. Ensure that the drain valve is closed. Once sufficient time has passed, clear away the towels and debris. If broken glass or other sharps are involved, use forceps to collect and deposit the material into a puncture-resistant container for disposal. Everything must be disposed of in an appropriately labeled biohazard bag or container inside the BSC. Clean and disinfect the area of the spillage again by wiping with a fresh paper towel soaked with disinfectant. If any liquid has passed through the grill, raise the work surface, open the drain valve to remove excess liquid, clean the catch tray, and then replace the work surface. Spray the full interior of the cabinet with disinfectant and wipe down as appropriate. If sodium hypochlorite was used for disinfection, make sure the cabinet is further wiped down with sterile water or 70% ethanol to avoid corrosion. Allow BSC to run for at least 10 minutes before resuming work or shutting down. If the spill is deemed to be minor, the cleanup procedure will follow similar steps to that of a major spill, but you may not be required to leave the biosafety cabinet. In this case, contain the spill with absorbent paper soaked with disinfectant. Leave the towel undisturbed for the disinfectant's appropriate contact time. When the appropriate contact time has passed, follow the steps as discussed before. Biosafety cabinets require a constant power supply to function correctly as a primary containment device. A sudden loss of power to the biosafety cabinet requires laboratory personnel to take quick action to minimize the likelihood of escape of biological material from the biosafety cabinet. Remember not to panic. If cabinet power is lost, stop your work immediately. Secure any infectious material by capping tubes, covering plates, and closing any open bottles. Disinfect and remove gloves inside the BSC. Remove hands from the cabinet, close the sash, and leave the area until the power goes back on. Notify others in the area of potential exposure to biological materials and place signage on cabinet indicating it is out of order. Once power returns, reopen the sash and allow 5 minutes for the air to purge and stabilize before recommencing work. If power is not reestablished, wait 30 minutes for possible aerosols to settle. Don additional PPE as required by your local risk assessment. Open the sash and surface decontaminate the BSC and all work items prior to their removal, allowing for sufficient contact time. Do not attempt to use the biosafety cabinet until the issue has been resolved. A highly useful tool to reduce the risk of power loss of a BSC is an uninterruptible power supply, or UPS. A UPS provides equipment with a limited amount of continuous energy when there is a periodic instability in the building's energy supply. A UPS can provide staff working at a BSC with enough time to properly secure infectious material, disinfect cabinet surfaces and other items, and appropriately segregate waste materials in a quick but safe manner. Generally speaking, a UPS capable of providing a BSC with 10 minutes of uninterruptible power should provide enough time for a worker to safely shut down the BSC before power is lost. Consult the manufacturer's specification for your cabinet's electrical requirements to select the most appropriate UPS for your needs. There are other unexpected instances or events, such as a medical emergency, building alarm, fire, or other immediate threat, where an operator may need to suddenly stop their work. If safe to do so, secure any infectious material within the BSC, remove PPE as per standard protocol, and exit the laboratory. However, the most important thing to remember in any emergency situation is that personal safety comes first. After any incident, it's important for laboratory staff to report the situation to their supervisor or safety officer as soon as possible. This provides the laboratory an opportunity to identify potential causes of the incidents and to come up with ways to reduce their likelihood in the future. Also, it ensures that any persons involved will receive appropriate medical surveillance if deemed necessary. Let's conclude this video with a review of the following key messages. A facility's standard operating procedures should include protocols for unexpected circumstances while working in a BSC. Spills should be promptly contained and decontaminated using an appropriate disinfectant for the specified contact time. Leave the cabinet running and dispose of all resulting waste inside the cabinet. With a loss of cabinet power or other emergency that requires immediate attention or evacuation, follow the same basic steps. Quickly secure biological material, remove PPE, and step away from the situation. No matter what the situation, remain calm, seek help from a coworker when you need it, and most of all, always remember that your own safety comes first. Having emergency procedures in place for biosafety cabinet work will help laboratory operators prepare for the unexpected. Thank you for your time, and remember, stay safe.